So Barbara, tell me a little bit about how your chest has been in the past 6 months.
In the past 6 months, my chest had been getting increasingly worse. I've been becoming more breathless, producing more mucus, having been generally restricted. I couldn't do as much, and it was getting that much, so much so that I was noticing that I was planning how I did things so that I could manage. For example, going up and down stairs, which you'd run up and down stairs normally, or wouldn't even think about it. I would sort of have to go up and then sort of have a bit of a breath at the top and recover, and then and tiredness, and because of the recurrent chest infections that I was getting, one sign that I have is sleepiness. I get very sleepy, very drowsy when I've got an infection, and again I was more and more drowsy, just feeling generally under the weather, and but the mucus and the coughing was the main problem. Just trying, and obviously the infection was.
So because mucus and coughing and fatigue were a big problem, we decided to help you with your chest clearance therapies. We did that through 2 ways. We started you off on a nebulizer called Hypertonic saline, and we did a challenge to that in clinic, which you passed well. Your lungs were happy to take on the treatment, and there was no adverse effects when we did the test dose. And you started doing that at home. How often were you doing that?
2-3 times a day, then mostly twice a day. More recently, because I've had such a good result and my chest is generally clear, and I don't even in the morning, because normally in the morning I would always cough, but because after the treatment now I barely cough up anything. At the moment I'm on once a day.
Fabulous. So hypertonic saline works by increasing the tonicity or the salt levels of the mucus in the airways, and that helps move water across the airways, which then helps the cells move better, and also hydrates the phlegm to make it move a little more easily. When it comes to chest clearance techniques, as a physio point of view, particularly if you're like Barbara and have fatigue, we want to make sure that your chest clearance is as energy efficient as possible, so that when you do clear your chest, you can get up the stairs and not be too tired or do some activities. And so we started you on a little device. This is the OPEP or flutter device.
That's right.
And tell me a little bit about how you feel that the PEP device has worked for you.
It's worked very well because it's so simple, and I think once you understand that you are clearing the base of your lungs, because I'm improving, again, I feel as though I'm breathing more deeply and getting to the base, and when I used it initially, it really did clear my lungs, but then as I've gone on and it's been more and more successful and I've improved, I'm getting less and less production. So as I say, at the moment I've got none at all, which is, well, I can say for years, I've always had something on my lungs. I've always been able to cough and you produce some mucus.
So with establishing this regular maintenance therapy, you've managed to clear your chest efficiently, and now we're maintaining it in a more clear fashion more regularly.
That's it, and I've just got into the pattern of doing it, and I think because that's part of I do it, I thought if I'm going to do it, I'm going to do it properly. So I did, and it has really worked.
Fabulous. So the OPEP is one of several airway clearance devices or adjuncts that physios can use or prescribe to help patients clear their chest. This one in particular works that when you blow into the device, it causes back pressure into the lungs, which splints open the small airways. As Barbara mentioned, it helps clear the mucus from her bases, and that helps her by splinting open the smaller airways, which were prone to wheezing or narrowing and collapsing when you were doing huffing and coughing procedures. That then traps the sputum, so you're huffing and coughing against a shut airway, which is a waste of energy. And like we said, when you're repeatedly having infections, huffing and coughing is a very high energy expenditure for a low gain when you're not getting any phlegm up and out. So this is one of the other ways that we can help improve and make your airway clearance more effective, and help keep that energy levels for the things that we want to do and live in life, which is what physio is all about.
Yes. Yeah, it's wonderful.
Fabulous. Thank you for chatting to us about your treatment, Barbara.
You're very welcome.
What would you say to anyone that, from a physio point of view, would be considering taking on some of these new treatments or something different for them?
Take it and do it, because I can't believe the difference it's made to me and to my family, because they can see the difference in there. But just normal things like going shopping, being able to go and walk around the shops, and just general or everyday things. And with this one, because there's not a lot of drugs, it's just so simple and very easy to use, and I'm just so thrilled, really.
Fabulous.
Thank you very much.
No, thank you very much.